Good morning, good morning, good morning, and welcome. Welcome back to the Great Lakes Health Radio program on 96.5 Power 96.5 or WUFO 1080 AM. I want to welcome you again. I'm Francesca Messiah from Kaleida Health, Manager, Workforce Development, and I want to thank you from the bottom of my heart for once again tuning in and listening to the Great Lakes Health Radio program, which is about your health and the health of your friends, your relatives, your family. And I'm just hoping at the end of the show, first half and the second half, that you pick something up that you can share with a friend. Well, today our first guest is Dr. George E. Matthews, Chief of Service, Department of Internal Medicine. And Dr. Matthews is also a cardiologist. So today's topic, we'll be talking about cardiac disease. How healthy is your heart? And a call to action, something for you to do for yourself and those around you. But first, let me start with Kaleida Health. Who is Kaleida Health? Kaleida Health, we're more than hospitals. We are in 10 of the counties throughout Western New York. And and I will name some of our hospitals. Our hospitals do include Buffalo General Medical Center. We have the emergency department at DeGraff Medical Park, Gates Vascular Institute, Oishei Children's Hospital, Millard Fillmore Suburban, Bradford Regional Center, Bradford, that's Bradford, Pennsylvania, and Olean General Hospital. Those are our hospitals. Our ambulatory centers, we have one on Harlem Road, one on Klein Road, our Millard Fillmore Surgery Center, and one in the Southtown's Surgery Center. We have blood draws throughout the 10 areas, 10 counties within Western New York, and we have all types of clinics for all ages, along with the Visiting Nursing Association that makes visits 24 hours a day, 7 days a week to your home, no matter how old or how young that person is who might need medical service. All right. And also, Kaleida Health, we have over 900 jobs on our website, and we want you to look at our website and apply for a job. Thank you. So let's move on with the interview, which is the impact of cardiac disease. Good morning, Dr. Matthews. How are you?
Good morning, Francesca. I am great, and I'm anxious and excited to speak about heart disease.
Yes, and Dr. Matthews, we've been talking about this program for a little bit, and I promise, because heart disease is what keeps us alive, we will be airing this program more than once. So I know we're going to be airing it a few times throughout the year. It's February, National Cardiac Disease. Is that what February is?
Indeed.
Okay. Well, let's get started. What does the heart control in the body, and why is it important to be concerned about your heart, including your blood pressure?
Okay. Well, that's a great question and to begin with. Um, the heart's main function for all that we do and think about is to pump blood. It pumps blood that carries nutrients and oxygen throughout the body to the various organs. Now, um, uh, we often consider other areas of the heart important, whether that's the arteries or the valves. And all of those other portions of the heart are very important, but it's important to maintain the function of the heart, which is, again, to pump blood. Now, when we think about the heart, we always will think about the illnesses that may affect the heart. And Francesca, you described one, which is high blood pressure. When the heart, as it's pumping blood, generates too great a pressure within the blood vessels, and that can be damaging over long term. Specifically, as the pressure rises within the blood vessels, It can damage the blood vessels, leading to blockages. It can damage the heart itself because the heart has to generate a higher pressure to effectively move blood throughout the blood vessels to the various organs. And that can, over time, weaken the heart itself, leading to heart failure or a weakening of the heart muscle. It can also, as we think about the heart, we have to think about the heart rhythm or the heartbeat, and that's the essential to maintain the appropriate cadence. So when we're walking, the heart may beat a little faster. When we're running, the heart may beat even faster, but the heart has to maintain what we describe as homeostasis, the ability to satisfy the needs of the body during various times, whether we're at rest, asleep, or awake, or exercising. So in short, in answer to your question, the heart's main function, for all that we think about, is to pump blood and nutrients to the various organs.
Mm-hmm. So I just a quick question. So if someone's walking upstairs, let's say you're working at, let's say you're at Kaleida Hospital and you decide, let me take the stairs, and then you let's say you're walking to the fifth floor, and you're huffing and puffing. Is it normal to huff and puff like that? And how long? And what is a normal rate versus you need to have yourself checked out?
Great question. When we think about doing any type of exertional activity, and walking up flights of stairs, a great example, we have to think about, first of all, have we done that and are we in adequate shape to perform that activity, whether it's walking up a flight of stairs, going for a run, doing some exertional activity. Have we done the appropriate, or have we gotten in adequate shape to be able to perform that activity? Now, if we're talking about walking up one flight of stairs, that should be easily accomplished. If we're talking about 5 flights of stairs, well, certainly if an individual is out of shape and has not done that, then that's not something that we would say would be easily accomplished. What we would be concerned about, if for the individual walking up one flight of stairs, to your point earlier, if they're huffing and puffing, then that's definitely not normal. Again, we have to look at it in the context of the individual's functioning, or what we call functional capacity. How much are they able to do, and is that too much of an activity for their level of conditioning? An example of that might be if I said, Francesca, I want you to run a marathon. You would say, well, I haven't trained for that. I don't think I could do that right now. But if you had the adequate training, you could do that. In contrast to that, if I said, Francesca, I want you to run 100 feet, you should be able to accomplish that activity with little or no difficulty. Again, we have to look at it in the context of what the condition is of the individual and what their exercise capacity is. Certainly, if the heart is weakened, then they're not going to be able to perform the most modest of activities. And that's the point at which a red flag goes up.
Hmm. Okay, thank you. Now, something we had also had talked about, we're talking about social determinants of health. It's something you hear all the time. We talk about corner stores. We talk about stores that are located in our communities that sell, as it relates to the heart, sells cigarettes, sells tobacco, sells vaping, cigars. They don't sell marijuana, but marijuana is something that you inhale. Between cigarettes, tobacco, vaping, cigars, marijuana, are any of those good for the heart?
Well, great question. So let's dispel any myths. And I'll start with the tobacco products. We know for the past probably 40 years that tobacco is harmful to health. So whether that's taken in the form of cigarettes, cigars, if it is inhaled, it is going to be harmful. That harm can provide for an increase in risk of heart attack, of stroke, of heart failure. So we know right off the bat that those are harmful aspects. Vaping also, again, we cannot say that that is a healthy activity. That is much more recent in development, but the adverse consequences of vaping do exist. So again, we're going to say that that is not a healthy alternative to other tobacco products. And let me then pivot now to marijuana, because as you know, there have been a change in the legal system so that marijuana is now
Legal.
sold and able to be purchased in a variety of fashions. What I would caution is that unlike the other aspects, tobacco in particular, marijuana has not been subject to the extreme rigor of what of the health benefits or adverse consequence of that particular product. In particular, marijuana may have a bad consequence or with a deleterious consequence or hazard for blood pressure. It may also contribute to that weakening of the heart muscle. There are a number of concerns about the utilization of marijuana in the form of being inhaled that may have potential adverse consequences. High blood pressure, heart failure, things along those lines. So again, because it's legal doesn't mean it's safe, and we've got to be very careful to separate those two. And as a cardiologist, I'm very concerned because there may be consequences that we may not see for 10, 15, 20 years down the road.
Mm-hmm. Yes. And speaking of this, that same corner store, another thing that's sold in many corner stores or just sold at grocery stores and around is alcohol. And I'd have never thought about, at first I was going to talk about congestive heart failure, but then I'm looking at congestive heart failure, but I'm really looking at alcohol. And, it's every month there's a celebration and you see alcohol commercials all the time on television. So is alcohol have an effect on the heart?
Well, a great question. And, there's been a lot of material that's been published about alcohol maybe having a beneficial effect or a harmful effect. And let me put it into perspective. Many years ago, there was individuals who lived in European countries, France in particular. They would have potentially less heart-related diseases, and it was surmised that alcohol may have been a contributing factor to reduce the risk of heart disease. And in particular, there was a suggestion that red wine may be healthy or may reduce the risk of heart disease. Fast forward to today, as we've gained more knowledge, as there have been greater epidemiologic studies, the World Health Organization has come out with a declaration that there is no amount of alcohol that is safe. So 1 glass, 5 glasses, an ounce, alcohol is not a safe product. So unfortunately, the World Health Organization has made that declaration and has been very, very precise in stating that. And it's now the role of public health agencies to disseminate that information to the best that they can. Now, that's not to say that if you go to a celebration and everyone has a glass of champagne and raises a toast, that you can't drink it. But as a matter of course, alcohol taken daily or a couple of drinks a week, probably not the best process or not the best habit to engage in. So just to reiterate so that there is no confusion, there is no amount of alcohol that is considered safe to ingest.
And listeners, I know that will be a real takeaway. No amount of alcohol is good. Good for your heart. Part of what got us started on this today's topic was a mutual friend of ours who suffered from a heart attack, but back to work and he's doing well. But my question is, many of us really don't know what a heart attack is. I know during the playoffs, people were sending little emojis around with, people holding their heart, but it's no joke to have a heart attack. So could you talk about some of the warning signs of a heart attack? And are the signs the same for men as they are for women?
Okay, great question. Okay, well, let's first define what we refer to as a heart attack. And classically, that's when one of the blood vessels of the heart is obstructed, is blocked off, and the heart does not get sufficient blood flow in and of itself to maintain the viability, to maintain the life of that portion of the heart muscle. And as a consequence, that muscle dies, or that portion of the muscle dies. So as you described, there are signs that men and women may experience. So let me go to the signs that in general that we describe as associated with a heart-related issue. It may be chest discomfort. And oftentimes the chest discomfort is described as a pressure, tightness, or squeezing. There may be discomfort in other areas of the body. Classically, we talk about jaw, neck, or the back, or discomfort that's in our arms. And I mention this because it's not infrequent that somebody will have a toothache or what they perceive to be a toothache or a jaw discomfort that may be the first sign of a heart-related issue. Other symptoms that may occur both in men and women: shortness of breath. The individual may break out into a cold sweat, and not like a light perspiration, but literally a dripping sweat, or they may have nausea or lightheadedness. Now, in men, the most common signs are the intense chest discomfort. Again, I don't like to use the term pain because it may be pressure, a squeezing sensation, or tightness. Men may also have discomfort that radiates into the left arm in particular. So those symptoms very common in men. Women may have a little bit different symptoms, and we have to appreciate that not everybody, and certainly not the different sexes, may have the same feeling. Women may experience less intense discomfort or pressure in the chest than men. Women oftentimes will have shortness of breath or may experience fatigue. Women may experience nausea, vomiting, dizziness, lightheadedness, or pain in the neck or jaw. Now, I say these men and women, and I differentiate, but without question, men may have shortness of breath, women may have very intense discomfort. So these symptoms may overlap, and men and women, acknowledging that they may experience them to different intensity or may experience them in different areas, they will often have the same types of symptoms. And just to reiterate, it's chest discomfort, discomfort that radiates into the arm, neck, jaw, shortness of breath, sweating, or what we call diaphoresis, another word for sweating, or nausea or lightheadedness. So those are the common symptoms that individuals will describe.
Wow, that's fascinating. Um, is a heart attack cause after a heart attack? Does one then have congestive heart failure? Only because I was recently having a conversation with someone and they said, "Oh, they just have congestive heart failure." Where I thought congestive heart failure was pretty serious, but the person I was talking to was like, "It's okay. It's just congestive heart failure." Is congestive heart failure serious?
Absolutely. So let's define what we're referring to with congestive heart failure and tie it back to your first question. Congestive heart failure is the inability of the heart to adequately pump or to provide the various organs with blood flow. And the reason we say congestive is because if the heart is not pumping adequately and pushing blood out to the various organs, then fluid can back up. And if it backs up into the lungs, we say that there's lung congestion or edema or pulmonary edema. If it backs up into the legs, we say that there's peripheral edema or swelling in the legs. So those are various areas where congestion may manifest. Now, let me just put it in a different way. At the beginning, we spoke about the heart being major function is a pump. So if it's not able to pump blood, then that leads to the congestive heart failure. But congestive heart failure may not or does not only arise from the heart attack. In African Americans, we see a significant amount of congestive heart failure that results from high blood pressure. So high blood pressure over many years, it weakens the heart, and we see that the heart is unable to pump blood, and then again, we get congestive heart failure. Additionally, individuals may have congestive heart failure because the heart becomes very stiff and is unable to fully expand to fill with blood. So it becomes very, very stiff and is not able to, again, adequately pump blood. So again, congestive heart failure or heart failure results from the inability to adequately pump blood, and that can result in fluid building up into the chest or into the extremities, the legs, and that is very serious. What we know is that if that goes untreated, that there is a high likelihood that the individual will not have a long life, that there is an increased incidence of sudden death, of premature death, of having major problems.
Mm-hmm. Thank you. And I just also want our listeners to know that if, I hear that, again, working in the community, I'm now in the area of workforce development, but I still do health fairs on occasion. I hear people sometimes say, oh, my high blood pressure medication is making me dizzy. If it's making you dizzy, talk to your cardiologist. Please talk to your cardiologist and make them aware. There are hundreds of different types of medication to bring your blood pressure down. So please, if you are feeling dizzy, it's not making you feel well, give them a call and get in there immediately. I just wanted to add that. Exercise, how important, and I know I said after 50 and you were like, oh, no, it's not after 50. How important is exercise to maintaining a strong and healthy heart?
Well,
even taking high blood pressure medication.
You hit the nail on the head. Exercise is wonderful beginning at any age. Exercise assists in strengthening the heart, improving the overall conditioning of the body. But in particular, if we're going to maintain a healthy heart, exercise assists us in maintaining our weight. It assists us in improving the vasculature, the blood vessels, and making sure that they can accommodate the various requirements needed to perform the various activities. It assists in strengthening the heart in particular. And so we don't want to wait till we're 50 or 60 to begin an exercise program. We want to say the younger, the better, because exercise at any age is helpful and healthful. So it helps us, but it also helps us maintain good health. And it maintains that good health from maintaining the structure and strength of the heart itself.
And I know that one thing when I was in the community, I would always, doing the health fairs a lot, I would say to people, coming to the table, just walk around the church parking lot before Bible study or before church or after church. Don't walk in the path of the cars, but normally a parking lot is a good space just to take a couple laps around, either with a friend or alone. Because walking is a fabulous exercise.
You know what? And I'm glad you mentioned that, Jessica. Um, Walking is perhaps the best exercise because we all have to walk to perform our activities of daily living. So if we get in the habit of walking, um, doing, as you described it, a couple of laps in a particular area, then anything that we do around the house should be almost a piece of cake because we're going to be able to navigate a much larger area in walking within our homes or apartments. We should be able to do that fairly easily. The times that I'm most concerned is when people do no exercise. And to your point, they don't even exercise in a small area. And as a consequence, they become less and less able to perform their activities of daily living. They become more sedentary. And unfortunately, that's not a prescription for a long and healthy life.
Yes. And Dr. Matthews, we only have 2 to 3 minutes left, but I just want you to take 1 minute, really about 1 minute, to talk about alcohol. I'm not sorry, talk about salt. I've seen you do presentations on salt. So if you could just say salt, cured meat, ribs, sausage, should we avoid salt? Is there any good salt?
Well, I hope that you wouldn't use a four-letter word on this discussion, but salt is a four-letter word, and it's one of the ones that unfortunately is very harmful to, and I'm going to say, to the population in general and people of color in particular. Salt, and I want to make sure I'm clear about this. People say, well, I use Himalayan salt or I use kosher salt. If it says salt, then we have to be very, very, very careful and judicious because that contributes again to the problems with blood pressure that an individual may be exposing themselves to. So if we can reduce the amount of foods high in salt, that's the best thing. Now, I'm going to be a little politically incorrect because we all like to celebrate and the Super Bowl is coming up and everybody's going to be having wings and a whole host of very, very enjoyable foods. But we've got to be very careful because those things may be high in salt or sodium. They may be high in cholesterol. They may be high in sugar. They may be a number of various areas that contribute to either high blood pressure or may contribute to diabetes or may contribute to obesity in general. So we've got to think very carefully going forward.
Yeah, and on that note, Dr. Matthews, our time is up, but I promise you the show will air a few times in the 2025 season. So I just want to thank you, Dr. Georgie Matthews, Chief of Service, Department of Internal Medicine here at Kaleida Health. And listeners, stay tuned. We have another exciting guest coming up. And now on to part two. Good morning, good morning, good morning, and welcome back to the second half of the Great Lakes Health Radio program on Power 96.5 FM, WUFO 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, Manager Workforce Development. Now, I just have to tell you why this show was so special. The show was special because the first part of our show, we had Dr. George Matthews, cardiologist. The second part of our program, we have Dr. Archer and his wife, Melissa Archer. I'll give you their titles in a second. But Dr. Archer had a heart attack. So today's topic is surviving a heart attack takes a village. And we'll talk about why that title came to mind. But this show has a story. The first part, the cardiologist. The second part, someone who actually survived what we're talking about. So let me first introduce our guests. First, we have Dr. Fred Archer. Good morning, Dr. Archer.
Good morning, Fran Messiah. How are you today?
Wonderful. Dr. Archer is a clinical assistant professor of pediatrics in the Division of General Pediatrics with the Jacobs School of Medicine and Biosciences. Also, attending physician at Niagara Street Pediatrics and Broadway Pediatrics. Also, Associate Dean of Admission at the Jacobs School of Medicine and Biomedical Sciences. And then we have his better half, the other half, Melissa Archer. Melissa Archer is a psychiatric mental health nurse practitioner and chief compliance officer and practitioner at Senses Medical Wellness, located in our community on Genesee. That's Genesee near Michigan Avenue. We'll talk a little bit about that. But the reason why I'm bringing you together today, the show, because surviving a heart attack, Dr. Archer had a heart attack, takes a village. His wife, Melissa, is a nurse practitioner who, when this first happened, immediately jumped to the scene, knew what to do with CPR. And the village were all the medical professionals. So anyway, Dr. Archer, if you could just say, I know in the first part of the show, Dr. Matthews talked about a heart attack, what it is, but in case someone missed the first half, could you just give us an overview, a brief summary, if it's possible? What is a heart attack? I mean, we watch Fred Sanford, we talk about bills, see people giving you a heart attack, but really, what is it?
Well, Fran, the short version of it is essentially something that causes the activity of the heart to not function the way it's supposed to. The job of the heart is to pump blood to all the organs of your body, especially your brain, your lungs, your kidneys, all the vital parts of your body. And if something disrupts that flow, that's a heart attack. And it really boils down to one of two things. Is it a plumbing problem? It's something with the blood vessels that stop blood flow to the heart itself, so the muscle then doesn't do what it's supposed to do, and then causes pain and that crushing weight on the chest. Or it's an electrical problem, which is what happened to me, because the heart, all that contraction of the muscle of the heart is started by electrical activity. And something disrupts that causes the heart not to pump effectively. And then no blood is going where it needs to go. And the body does not like any of that. So that's what I would call the lay definition of a heart attack. Something making the heart not pump the way it's supposed to.
Yes. Okay. Well, your story is fascinating. And we're going to get into the story now. Do you recall any symptoms, or Melissa, do you recall anything that may have made you think, because Melissa is a top-notch nurse. She's a medical professional, a nurse practitioner.
And Fran, the best person to tell the story actually is Melissa, because when you ask, do you remember what happened? I do not recall exactly what happened. I think that was something my brain wanted to protect me from that. So
how about symptoms? Did you remember? Because I think they said you were eating pizza, watching a game, right?
I was like many a Buffalonian, I was watching a Bills game. Happened to be the Bills-Seattle game on October 27th. And that morning, we'd actually participated in a function called Cycle Nation, which is with the American Heart Association, to raise funds and bring awareness to stroke and heart health here in Western New York. Irony of all ironies. We're riding bikes, we're having a good time. We go home, we order some pizza, we walk the dog, we sit down, we watch the game. And next thing you know, I'm having an episode.
Yeah.
So when you talk about were there warning signs, a lot of times there are not. People, when they talk about a heart attack, they expect there to be, I'm feeling this crushing, I'm sweating and all that. And in many cases, you do have that. But a lot of times it can come out of the blue. And sometimes people don't recall what happened during those events, because as that blood flow to vital organs, especially the brain, starts to get cut off, your brain says, let's just take a break for a minute. Let's take a pause on that. So I don't have a lot of clear memories of what actually happened there, but I know Melissa does.
Okay, take it away, Melissa Archer.
Yeah, so just like Fred stated, first of all, thank you so much for having us on, definitely to talk about this important issue and, how we can help other people have the same outcome that you guys call him Dr. Archer, I call him Fred. So we went to Cycle Nation and, came home and as we do with all our games. We get pizza once a week to watch the game. And we're cheering for the Bills, of course, and they had scored. And he kind of sat back. We're all piled up on the bed. It's just pure chaos. And he kind of just laid back against the headboard and kind of, I thought he was just kind of making a face, but then something told me to look back real quick. He was unconscious. He was having what we call agonal breath, so breathing very irregularly, and he literally turned blue. So I was like, wait.
He turned blue?
Yeah, I was like, this is not good. And so when I realized like he wasn't playing, because we were always playing pranks, that I said, well, there's something going on. So quickly, just like I'm calling his name, I'm, gently slapping his face. Probably.
Was he responding?
No, he wasn't. He wasn't responding. So I immediately started CPR. Our 13-year-old son was was home watching the game with us. So, I'm literally screaming, of course, in a situation like that. It's very different than when you're in the hospital. You press the cold button, and you have a whole team of nurses, doctors beside you, medications, everything. But you're at home, with your 13-year-old son, and it's like, oh shoot, this is it. It's just us. So quickly jumped into action. Our bed is kind of high and with wooden floors, and there was no way I could get him down safely without creating even more medical injury. So I had to do CPR on the bed. And then at that same time, I was screaming to my son, he called 911 after we found the phone, because of course we couldn't find the phone in that moment. He created our dog. He, opened up the door for EMS. And thank God, one of our neighbors is a commissioner for the Snyder Fire Department. He ran across the street, because he was across the street watching the game with other neighbors, and started helping me perform, CPR. And then, after that, he called in the cavalry, I feel like, because then the Snyder Fire Police were there, the Snyder Fire Department, Twin City Ambulance, Amherst Police, they all came, and neighbors came, and, was taking care of young Fred. And then, they just sprang into action. And, because when you're doing CPR, you've got to probably, it's very muscle and labor intensive. So that's not something you can keep up for a long term. So I was very thankful that they came. When you talk about the city of good neighbors, we definitely, our street is the best neighborhood. Definitely the city of good neighbors, because they came out on a way that I never would have expected, showed such humanity and grace in doing so. So then, Fred got shocked around 6 times. And
what does that mean? He got shocked?
Yeah. So they had to bring out the defibrillator, or AED, automatic electrode device. And it gives a shock to the heart if there's a shockable rhythm, to try to get it back to what we call sinus rhythm, because he had an arrhythmia. So they literally shocked him twice. After like the second time, I couldn't continue to watch. And then, he got the emergency medications that were needed. And, while they're working on him, and it literally felt like about 40,000 people were in the house. While they're working on him, I'm calling everybody, family, friends, especially those that are in medical, and got a hold of, Dr. Millings and Ken Snyder and Dr. Matthews. It's people that really kind of helped us, navigate this. And initially, Fred was not responsive. Dr. Archer was not responsive. So he was going to go to one hospital, but then he came back. He fought back, and was responsive, very talkative. So I ended up going to Buff General GVI with Dr. Iyer and Dr. Bhatia, amazing, top-notch cardiologists and cardio electrophysiologists, respectively. And they really worked with navigating his care, along with my uncle, Dr. Brown, what we call him Papa Brown, and our really good dear friend, Dr. Joe Cronin, who in adult medicine are probably some of the 2 smartest men we know. And together, like the team of 5 really just helped him, navigate the next steps of our new normal. And to the point where, it was such an outpour of love and support, we really wanted to do something. So we did have a celebration of life around that, to also for healing, but also to really, showcase, like, from the housekeeper at Buffalo General to the nurses, to the doctors, to everybody that we came into contact with, they really, the humanistic, the holistic, the care, and that Fred was given is the reason why he's here today. So yeah, so it was an experience, not one I'd wish on anybody, but definitely one that makes you more resilient and more more thankful of just even the smaller things in life, not just from an individual standpoint, but from a family and community standpoint.
It takes a village. Now,
Thanks, the village.
yeah. Now, Melissa talks a little fast, and I was trying to count, but I think I counted a good 12 plus people who were part of your village. So,
at least.
yeah. And
Dr. Emmy Nylander, Fran Messiah, Jessica Frederick, another nurse practitioner. I mean, like, it's so many, our neighbors, it's just so many people that's why we had to do a big celebration, because it was overwhelming, because not even just nationally, but internationally, friends of Fred's, Cornell University, just so many people, just such an outpour. And I thank them for not making me a widow, not making our children fatherless, not making his mother have one less son. And the community needs Fred. Like, he is, his patients, the students, the organizations, the communities he work in, they absolutely love and adore and respect. And, he is definitely a mentor and a leader. And we do the work. We're so busy doing the work with, as I say, 10 toes, 10 fingers down, but it really kind of showed itself when we needed them. And because we're usually the ones that people come to us for and stuff. So it was hard to kind of be on the other end of that. But, we learned quickly, because we had no choice to kind of gracefully and humbly be honored and thankful that we had that support, from bringing food to let me come clean the house to, hearing me cry, or, being there for Fred, Dr. Jeremy.
And your daughters, we got to mention your daughters.
Oh yeah, Dr. Jeremy Killian, they went out Lego shopping, and, and our girls, absolutely. Samantha came, she couldn't even get down the street. There were so many cars, and she really grounded us. After everything was quiet, he's off to the hospital, and the Amherst police were about to escort us to the hospital. She said, "Mom, let's pray." We went in the bedroom and prayed.
Right. Yeah. And for those of you who don't know Dr. Archer, he's a big Star Wars fan and other fans, but talk about the Force being with you. The Force was really with you.
I'll tell you, Melissa's a force to be reckoned with. I'll tell you that.
The Force to be. So is there anything you think that could have prevented all this from happening?
And I'll be honest with you, because it was an electrical issue that I previously didn't know about, there may not have been a lot of signs and symptoms beforehand. But that's why one of the things I tell people, aside from learning CPR, knowing CPR, getting out there and learning hands-only CPR, because you can change and save somebody's life. But for individuals, make sure you follow up with your doctor, get a yearly checkup, and also talk to your family members and get that family history. We talk about it with respect to cancer, like, oh, there's breast cancer in the family, there's colon cancer in the family. You should know about that and get yourself screened early. Same thing goes for heart disease, whether it's caused by a family history of elevated cholesterol or a family history of electrical problems with the heart. You might hear the term arrhythmia, which means it's an irregular rhythm to that heartbeat, which is an electrical problem. If you can figure those things out early, you can actually get things done or get treated so that you don't have these problems in the future. And so prevention is definitely one of the key components with it. But I would be remiss if I did not put that plug in there. Everybody need to learn CPR. Everybody. They're actually countywide initiatives to get, as many, what is it, like 30,000 people trained, 150,000 people trained within Erie County knowing how to do CPR. Because that way, no matter where you are, there's somebody that can help you, somebody that can provide some aid until EMS and fire and things arrive.
Yeah, and I mean that's just so it's just so mind-boggling, because I mean I hear about CPR and last year I don't know, it was UBMD, but at Juneteenth, whoever the group from UB that was next to the health tent, the Kaleida Health, where Kaleida Health and ECMC were last year at Juneteenth, they had they had CPR, like the dummies.
Mhm.
And
Mhm.
and I guess maybe I was dumb in the sense that I didn't even go and try. I mean, they were that close to me. And I was watching people take turns, trying the CPR because I guess I'm a little afraid. So what would you and Melissa tell for someone like me, who seems like they got all that going on, who would be somewhat afraid to press on someone's chest? Like, what are the things that you're trained to do in CPR to help someone like me overcome fear? And our listeners, might be a couple of listeners who are afraid as well.
Yeah, that is the studies have shown, I think it's like 1 out of 10 home sudden cardiac arrest, they, make it. And then if there's too much oxygen deprived from the brain, what level of functioning are they, even though they made it, what level of functioning are they at? And it is scary. It's scary for healthcare professionals that are trained. And, I'm a military veteran, did this in the military too. So, it is scary, even with all that training. Even more so when you're at home and this is not your norm, right? So,
Right.
so we have, we talk to different cardiologists, and they said sometimes even people that know CPR at home, they're so scared to touch their loved one because first of all, it's like, is this really happening? You're having to grapple with that. So that's why, definitely there has to be that emotional regulation of like seconds means life. So you have to put that to the side and jump right in, and it's hard. And it's messy, depending on the situation. With somebody, if they fell and hit their head, are they bleeding? I mean, not to get too graphic, but this is just the reality of it. And, we have to put those moments to the side because you literally have 5-6 minutes. And after, the brain is deprived of oxygen for that long. Now we're looking at some long-term cognitive, physical disabilities that, may not be able to kind of overcome, or, it's definitely going to be a very stretched new normal for that person and the family and the caretakers. So it's just like jump right in, but practicing getting CPR. And then, I think the current guidelines now is every 2 years, but, every month revisiting that. Every month, just like it can be a pillow that you're just practicing doing some, what you learned, obviously, doing CPR, the hands only compressions, just so that when it does come, it's like driving. We get in the car, and so, you get in the car, and you're like, how did I end up at TOPS? Like, what is going on? How did I end up here? It's just like, it's that muscle memory.
So,
And,
so speaking of muscle memory, so for someone who's listening, CPR, is it the center of the chest, the left or the right? Is it like someone's left, someone's right? Where exactly do you begin? Because it could be someone listening right now that something could happen within seconds. Is it the center of the chest, left, right? Where do you start?
It's I mean, without like showing,
Right.
The heart is on the left upper of the chest. So let's be very clear about that, right? It's not on the right side, but you're doing it. It's called the sternum, like on the sternum, but like more towards the left. But I don't want to say, I don't want to say like particular, but like, yeah. So it's in the middle, but more towards the left, because you are literally pumping. You're doing what the heart does. You're pumping blood throughout the body. So the blood that needs to get oxygenated goes to the lungs and goes to the heart to get pumped out to the rest of the body, right? So you're pumping, you're keeping that blood going. And the biggest thing is keeping it going to that back to the heart, so it can keep pumping, and also back to the brain and back to the lungs. So you're literally that hands only compression. You are the lifeline of that person at that time when they're down.
So if somebody wants to go for CPR training, because I know that's what you and your husband, Fred, Dr. Archer, are promoting, where would someone even find to go for CPR training?
So the American Heart Association is excellent. And I know we're in talks with the American Heart Association. I know also UB has some initiatives, and I'll let Fred speak more to that through UBMD and the Buffalo Bills. And then we are in talks with our local, Snyder Fire. I think we have a meeting tomorrow, actually, to just talk about how we can. There's so many initiatives right now, and that's so awesome that it's happening. But just making sure we don't miss any gaps, like how we can fill those gaps, and not just from in an urban area, but suburban and what we're finding in the rural areas. It's 45 hour for an ambulance sometimes to get to them. That's not even sustainable to do CPR for an hour if you're by yourself. So it's like, how can we not only help, just if you're a human being and you're here, how can we help folks get the training they need? And also how we can get AEDs in spaces that may not always be in spaces in the field, and have people trained on how to use them. And then there's, the maintenance of it, and, and the operations of it every year, having somebody come and check that. Because wouldn't that be amazing if I'm in TOPS and, I go down, because it can happen, like, Fred said, it's an electrical issue, so you don't know. Or if it is a plumbing issue, if you have clogged arteries, and somebody goes down, if 10 people are around me and maybe 7 or 8 knows, I have a better chance of survival, and vice versa, right? So if one person only knows, my chance of survival, and then even having a sustainable life afterwards, where I'm at my optimum level of functioning, or maybe even, where my baseline was, it increases the more people know.
Are you in touch with any of the community centers? And I should have written the name of the community center down, but the one where Catherine Roberts is the executive director it's on East Utica.
The Resource Council.
The Resource Council. Thank you. Only because they have so many activities. Are you in contact with them by chance?
And I don't want to overspeak Dr. Fred or Dr. Archer, but we are in the process of formulating all that. He created a Archer Community Heart Health Awareness Project. And I say him because it's like, this is his healing journey. Of course, I'm always.
But it's really an us thing. It's a family project. It's something that the entire family's behind.
Well, let's talk a little bit about that. And what is it called again?
Archer Community Mental Health Awareness Project right now.
Archer Community Mental Health, gotta have mental health awareness project. Okay.
Yeah. And the whole point behind that, again, is getting awareness of this information out to the community. And a lot of that means, we have been working in these spaces for years now, and we know a lot of these people, a lot of these organizations, a lot of these groups, and we want to be able to go into those spaces talking with trusted members of the community already to get education about CPR out there, get some AEDs out to these places, both in the deep parts of the city and deep rural areas, because, heart disease doesn't discriminate. It hits everybody.
No, it does not.
It hits everybody. And just like Melissa said, having people have that awareness during the episode, because, like you had said, people are afraid to touch a loved one. No, I don't want to hurt grandma. You want to, they say that if you're not hurting the breastbone, the chest, then you didn't do CPR right. You got to be pushing that thing down to you almost hitting the spine. And getting people to be mindful in the moment. It's okay to be scared. It's okay to be nervous. It's okay to be worried. But while you're doing that, you need to be doing CPR. So how can you, in the moment, take those feelings and use that stress and that energy and anxiety to drive the CPR you're doing, rather than doing, woulda, coulda, shoulda, and worrying about it later on. So learning how to be mindful in that situation. And the other component of that is what happens afterwards. Okay. Yeah. This is where your village really kind of comes into play. The people that supported you beforehand, supported during, are they the people that are with you afterwards? The folks that help you get to those doctor's appointments, the people that sit with you when you're just worried about, do I need help walking to the bathroom? What am I doing? Can I go back to work? What am I going to do all day long when I'm just sitting here in the house? And being there for those folks mentally as they recover and get to their new normal, because there's no going back to normal. That doesn't happen. Things that we have done differently, even though this was an electrical issue, not a cholesterol or plaque related issue, we've definitely changed our diet around. We've changed the type of stressors that we actually let into our lives and into our house. We're all a lot more relaxed now. We talk to each other. We restore each other. There's a lot of things we've kind of done just as a family with that, and that we've done when we go outside. When I go to work, if someone comes in kind of stressed, like, we need this done, I'm like, okay, I'm not going to get stressed about it. Put it on the calendar. We'll get it done. And I find that I'm a lot happier as a result of that.
Are you happier, Melissa? Are you happier?
I'm happy he's okay. Yes.
Okay.
No, it does make you pause and really look at the mental and emotional well-being of things. And, I think that's one thing we really want to, stress as well, is when you go home and you don't have all the supports and things like that, and you have to grapple with wow, what happened to me and what's my new norm and how am I going to navigate and still feel like you, right?
Right.
And so, and with me being in psychiatry, I'm always looking, always like making sure everybody's good, everybody's
Right.
okay, and checking in.
And I guess another thing is like, are people looking at me differently? Do they say that? Am I, are they going to include me in on things? But we have about 2 minutes left. What are some things you want to hit, make sure are the takeaways from today's conversation?
Mm-hmm. Okay, I'll go first. Learn two-hand CPR. Learn how to use AEDs. Know where they're at when you go into any building. Offer support for anyone around you that is in need. Know your family history. Know your history. Get your numbers. I mean, your blood pressure, your your A1C for your diabetes. Know your health and be an advocate for that. And watch your stressors and how you're eating. Just basic stuff, that we think is basic, but we get caught up in the day to day. May not be so basic and commonly known. And just really reach out to your fellow person and just, and just kind of be kind.
And get your annual checkup.
Get
Dr.
your annual checkup.
Yeah. Okay. And Dr. Archer, we are very happy that you are here. We're very thankful that Melissa was there for you. And we just want to say, because we're out of time, we just want to say on behalf of the community, on behalf of the children and their parents, because you are a out of sight, wonderful out of sight pediatrician.
I had good parents and good teachers.
Yeah. And Melissa is again an out of sight mental health professional. I mean, this couple is amazing. And I have to say, yes, they are my friends. And I knew part of the story. I just wanted to share it with you, with the rest of the world, and with Dr. Matthews leading the conversation. And on that note, I want to say thank you again for being part of our conversation today. Surviving a Heart Attack Takes a Village. On the show, we've had Dr. Fred Archer and his lovely wife, Melissa Archer. I'm Francesca Messiah, Kaleida Health Manager, Workforce Development. Next week, you'll hear my esteemed colleague, Cindy Bass from Erie County Medical Center. Be safe, learn CPR. Bye-bye.